Aminoglycoside antibiotics. All these drugs have amino sugar in the glycoside linkage. These drugs have amino sugar as well as glycoside linkage, so these are known as aminoglycoside antibiotics. Glycoside is naturally present in plant containing sugar and one or more compound linked by ether. Cardiac glycoside, digoxin. As the example, classification. According to the base, they are classified from bacteria of Streptomyces genus, Streptomycin, Kanamycin, Neomycin, Sophromycin. From the bacteria of Microsporum genus, Gentamycin, Nettlymycin, Schistosomycin, Amikacin. Common properties of aminoglycoside. All contain glycoside linkage, mainly effective against gram-negative body. The common bacteria of aminoglycoside antibiotics are all these contains glycoside linkage, as I said in above, mainly effective against gram-negative bacteria. These are effective against gram-negative bacteria. Same mechanism of action, protein synthesis and bactericidal action. These prevent protein synthesis as well as bactericidal action. Excreted unchanged in the urine. Produce two toxicity and nephrotoxicity and neuromuscular blockage. These produce toxicity and nephrotoxicity and neuromuscular blockage. Anaerobes are resistant to these drugs. Anaerobes are resistant. These anaerobic bacteria are resistant to these drugs. These aminoglycoside are common properties of the aminoglycoside are all contain glycoside linkage, mainly effective against gram-negative bacteria, and same mechanism of the action, prevent protein synthesis and bactericidal action. These aminoglycoside prevents protein synthesis as well as bactericidal action. Excreted unchanged in urine. Produce toxicity, nephrotoxicity and neuromuscular blockage. Anaerobes are resistant to these drugs. Mechanism of action. Entry of aminoglycoside into bacterial cell, which requires O2. These aminoglycoside which enters into the bacterial cell which needs O2. This O2 binds to 30S ribosome subunit. This aminoglycoside binds to 30S ribosome subunit because these prevent, as I said above, these prevent protein synthesis. So the main reservoir for protein synthesis in a cell is ribosome. So these aminoglycoside bind to the 30S ribosome and block the initiation of protein synthesis. It was the first step, as well as terminate protein synthesis and addition of wrong amino acid. This lead to inhibiting of protein synthesis. These three leads to inhibiting of protein synthesis, and this causes a bactericidal action. This is the action mechanism and action of aminoglycoside. First, they enter into the cell with the help of O2 and bind to 30S ribosome subunit to prevent protein synthesis. They prevent protein synthesis by blocking the initiation of protein synthesis, terminate the protein synthesis, and addition of wrong amino acid. These three results in inhibition of protein synthesis, and this causes bactericidal action. And antibacterial activity. Aminoglycoside aerobic. They are virulent against aerobic and gram-negative bacteria like E. coli, Proteus, Pseudomonas, Salmonella. effective against Mycobacterium tuberculosis. Like these streptomycin and amikacins are effective against this Mycobacterium tuberculosis. According to the classification, these streptomycin and amikacin are effective against Mycobacterium tuberculosis. Now effective against anaerobes. There is no effective against anaerobe. These are effective against only aerobe. Common toxicity. OTO toxicity, which causes mild deafness and tinnitus, dizziness due to vestibular effect, renal side effects, albuminuria, more neuromuscular blockade with Curare-like neuromuscular blockers. This common toxicity which causes neuromuscular blockage like Curare-like action. This Curare is a neuromuscular blocker. Use of gentamicin and amikacin. This gentamicin drug and amikacin are used in urinary tract infection, septicemia, burns, bone infection, soft tissue infection, eye ear infection, meningitis. These are given intramuscular as well as intravenously or in a topical route. These drugs are administered in these three routes. Streptomycin. From Streptomycin greases, which was found by Waxman in 1943, used in tuberculosis, plague, endocarditis, rat bite fever. These are topically used. These drugs are topically neomycin, gentamicin and soframycin and amikacins are topically used like eye drops, ear drops, cream, powder. Thank you. For more videos, please do subscribe, like, share, comment.